Hello, I'm Michelle Embleton, and in this video I want to talk about what is co-IVF and how does it work. Co-IVF is known by several different names such as reciprocal IVF, shared motherhood, partner-assisted reproduction, or perhaps even the ROPA method. It is an assisted reproduction technique aimed at two women in a same-sex female relationship, whereby one woman becomes the genetic mother by donating her eggs to her partner, who then carries the pregnancy. This technique allows both women to feel really actively, emotionally and physically involved in the pregnancy. In this video, we're going to have a look at what is co-IVF, what are the steps of the process, what medical requirements are they for both women, have a little look at the legal aspects, and then finally have a look at how much do these treatments cost. We'll then finish the video by having a look at some of the most frequently asked questions from our users and answer them for you. Co-IVF or reciprocal IVF is an in vitro fertilization treatment aimed at same-sex female couples. In this treatment, one of the women is chosen to be the genetic mother and will provide the genetic load of the baby in the form of her egg cells. Ovarian stimulation will be performed. The eggs will then be retrieved and then fertilized with donor sperm in the laboratory. The embryos will be cultured for a few days and then they will be transferred to the uterus of the other woman in the relationship, who will then carry the pregnancy and hopefully have the future healthy baby. In this way, it allows both the women to actively participate in the process of becoming a mother, even though their individual journeys are quite different. The genetic mother will have to undergo ovarian stimulation and the egg retrieval process, and the pregnant woman will have to undergo the preparation of her endometrium, the embryo transfer, and carry the baby. The steps of the reciprocal IVF process are basically the same as IVF using an egg donor. The difference here is that the egg donor is your partner. The woman selected to be the genetic mother will undergo ovarian stimulation. This process is whereby, with hormonal medication administered to the woman, many eggs are developed within the ovaries. This will be carefully monitored by ultrasound, and when sufficient size and maturity of the eggs has occurred, the ovum pickup will be programmed. This ovum pickup, also called a follicular puncture or an egg retrieval, is a simple surgery which is carried out under mild anesthetic or mild sedation. In this process, the woman will have the eggs aspirated from her ovaries. Following this process, the eggs will then be taken to the laboratory. In the laboratory, they will be fertilized by donor sperm. This sperm may be from an anonymous donor. In many countries, donation of the sperm is an anonymous and altruistic act, or if you are in the United States, you may have chosen to have a sperm donor. Either way, the sperm will have been previously frozen, with it being donated sperm, and it will have to be thawed, check the survival of the sperm. It will be processed and capacitated, ready to then provide the fertilization of the eggs and the sperm. The sperm will be mixed with the eggs, or alternatively, if intracytoplasmic sperm injection is used, a sperm cell will be selected by the specialist and injected directly into the egg cell. After the fertilization process, the embryos are allowed to grow for a few days in the laboratory. When the embryos are ready, the very best embryo will be selected for the embryo transfer. While the embryos are developing, the mother who is going to carry the baby will undergo preparation of her endometrium. This can be done in a natural cycle when the endometrium prepares naturally, but it is more likely that she will undergo hormonal medication with progesterones and estrogen in order to make sure that the endometrium, which is the lining of the uterus, is at the correct thickness to increase the chances of implantation. When the embryos are ready and the endometrium is ready, the embryo transfer will take place. Usually only one or possibly two embryos are transferred into the uterus, and any remaining embryos can be vitrified, which is cryogenically preserved, for later use. Possibly the most difficult step of the process is the next bit, which is the 2-week wait before you can take the pregnancy test to see if the treatment has been successful. It is important in the 2-week wait, sometimes called the beta wait, not to perform a pregnancy test, as false test results can be obtained due to the hormonal medications taken in the process. After the 2-week wait, you can take the pregnancy test. Well, the requirements of each mother are going to be different as their role in the process is different. For the genetic mother, she will most likely be the younger of the two, since the quality and quantity of eggs available in young women is greater. The ovarian reserve, the number of eggs you have, decreases according to age. Also, the quality of your eggs can decrease with age. It's not always the case that it's the younger woman, but usually it is the way it happens. This woman will also undergo possible chromosomal analysis, karyotyping, to make sure there are no chromosomal aberrations. By performing these tests on the genetic mother, we can ensure that any of the embryos which are produced are more likely to be successful in their implantation. In the gestational mother, the woman is going to carry the baby. She obviously needs to have a healthy uterus and be of good physical health in order to be able to carry the baby throughout the pregnancy. It's advisable that she doesn't have any autoimmune diseases or blood clotting disorders, which could pose risks to the baby and the mother throughout the pregnancy. So it's really a matter of working with your specialist and your individual cases to decide who is going to be the genetic mother and who is going to be the gestational mother. Well, when we look at this process, basically, the woman who is going to provide the genetic load is acting as an egg donor for her partner. And depending on the country or possibly the state where you live, there may be laws governing this. In Spain, for example, the law states that egg donation is a totally anonymous and altruistic process. However, if you are in a legally binding relationship and if you're married, this process is allowed to occur. If you do not have some sort of legally binding relationship, you will not be able to donate your eggs to your partner. As I've said, it does depend on the specific country you live in, so you do need to consult with legal advice, and your clinic may help you with this information. In the United Kingdom, the rules about this process are governed by the HFEA. And if the procedure is carried out in a licensed clinic, the woman providing the eggs doesn't have to be a registered egg donor if they are donating to their partner. Being married or in a legally binding civil relationship really helps to facilitate this process. In the United States, as you can choose your egg donor and indeed your sperm donor, the issue of the woman donating her eggs is not a problem. However, you do need to make sure you think about the sperm donor, and if you use a known sperm donor, that maybe you need a sperm donor agreement to make sure that that person does not have the parental rights over the baby. When using a reciprocal IVF, ROPA IVF, co-IVF, do always take legal advice to make sure both of you will be the legal parents and guardians of the child. Well, the costs involved in reciprocal IVF are basically very similar to those in conventional IVF. In the USA, you can expect to pay between $10,000 and $15,000 per cycle. This doesn't include the costs of the medication needed in the ovarian stimulation or the preparation of the endometrium, and these can sometimes cost between $1,000 and $3,000. The price for an IVF cycle or a reciprocal IVF cycle in the UK is around £5,000, and in Canada, it can cost around 7,000 Canadian dollars. Many people opt to come to Spain for their treatments in assisted reproduction, since it is a country which is very advanced in the field. And in Spain, an IVF cycle can cost between 3,000 and 6,000 euros. Again, costs of hormone medications are not included. Often, your clinic, if you are paying privately for this treatment, may have multi-cycle offers or further embryo transfer offers, so it is best to inform yourself with all the options available before you decide on your final treatment. Now I want to have a look at a couple of the most frequently asked questions from our users. Basically, the answer to this is yes, the embryos will belong to both of the women in the relationship, and providing both of them have the fully functioning uterus that can carry a pregnancy to completion, both of them can opt to have the embryos transferred into their uterus in the future. In this way, both women may participate in being pregnant at some point in their lives together when they decide to complete their family with more children. Well, this question is really when we're thinking about using an anonymous donor, which is actually the case in the majority of countries. In this case, the clinic will select the donor based on phenotypic characteristics, what you look like, eye colour, hair colour, and genetic compatibility, things like blood types. They will usually think more about the pregnant mother to match with her characteristics, so the baby will look more like her, since the genetic mother is already providing her genetic load. But in reality, both women's characteristics will be taken into consideration. We want to hear about your experiences, so please leave us a comment below. And if you've liked this video and found it informative, don't forget to click like and subscribe so you don't miss any future videos. And as always, I would like to remind you that in the description below, I leave you with a link to the article when you can read a lot more information. Within this article, there are links to several other articles which you might find interesting about all the different assisted reproduction treatments available for third-party reproduction.